Good evening, everyone, and welcome to tonight's MLA Productivity and Profitability webinar. These webinar series deliver topics pertinent to beef, sheep, and goat producers. My name is Hilary, and I work for the Webinar Coordinator's Home Circuit. Tonight's topic is reproductive diseases in cattle, the causes, impacts, and management. I'll just start off tonight's webinar with a little bit of housekeeping for those who haven't attended a webinar before. This is your control panel. It should be at the top right-hand corner of your screen. The red arrow on the left collapses and reinstates the control panel. You should not be able to, you should be able to hear us, but we cannot hear you. As Michael is going through the presentation tonight, please type the questions in the box provided, and I will relay them to him at the end of the webinar. Please make the questions as succinct as possible so that we can get through the question time efficiently. I'll introduce tonight's presenter, Dr. Michael McGowan of the University of Queensland. Michael is a professor of livestock medicine in the School of Veterinary Science at the University of Queensland, honorary professor of farm animal medicine and surgery at the Royal Veterinary College, University of London, and a diplomate of the European College of Animal Reproduction. His areas of research include defining the pathogenesis and impacts of bovine pestivirus, BVDV, leptospirosis, heat stress, and neosporosis in dairy and beef cattle, development of bull selection and management strategies, defining factors affecting the reproductive performance of beef and dairy cattle, and development of methods of synchronizing estrus and ovulation to enable AI at a fixed time. Wow, that's an impressive list. I will hand over to Michael now. Should see something pop up on your screen soon.
Yeah. So now I just click show my screen.
Yep. Fantastic. Thanks, Michael.
Thank you very much, Hilary. And it's an absolute pleasure to be speaking with you all today. Hope you've got a bit of rain. We've had a bit of a sprinkle up here, and it's a special pleasure because I'm speaking to some fellow Southerners. And as the shot here shows you, I grew up on a small wheat, sheep, cattle property west of Tamworth, and spent a fair bit of time driving round and round paddocks. But the focus of our presentation today is calf wastage. What do I define as calf wastage? Losses between confirmed pregnancy and weaning. I think it's important to understand, particularly with some of our infectious diseases, that they express their effects as early as failure of fertilisation, death of the embryo. In other cases, it will be abortions through to birth of stillborn calves, weak malformed calves, through to calves that don't thrive and subsequently die. So we look across the entire spectrum. Want to put calf wastage into perspective. What are the major drivers of live weight production of a beef herd? And there are 6 main drivers, one of which is the percentage of calf wastage. So you can see them listed there. Work that we've done here in Northern Australia demonstrated that if a cow fails to wean a calf, her live weight production drops by 130 kilos and business drops by $140 odd. Key thing is significant calf wastage is going to affect the farm bottom line. So one of the questions you might be asking is, how big is the problem of calf wastage? Well, I did a little bit of work and looked at the literature with regards calf wastage in southern Australia. That in beef CRC3, they provided the data on calf wastage. It was 8%. So 8% of mated females failed to deliver a calf, failed to wean a calf, and that was made up of abortions 3%, stillborn dead calves 2%, and then another 3% losses after calving, from calving up to weaning. I've looked at the New Zealand data, and similarly, estimates of calf wastage there, about 9%. Often producers will ask, is it possible to achieve 0% calf wastage? In other words, if I put 100 pregnant cows in a paddock, can I wean 100 calves? Look, in small mobs, that's possible, but it's rarely repeatable. And when we get into the, when we look at larger populations of calving females, we find that there is, annually, there is a low level of calf wastage. In well-managed herds, heifer mobs, an achievable level of calf wastage, 7%, cow mobs, 5%. And I've given you some indication there of in what situation would you consider investing in an investigation to determine what is causing the higher than expected calf wastage. And in heifer mobs, greater than 10%, cow mobs, greater than 8%. Now, in some highly fertile herds, which are consistently achieving calf wastage in the order of 5%, the threshold to trigger an investigation could be lower than that. So that just gives you a ballpark figure. I pulled up this ABARE data on branding rates to try to get a feel for what the background calf wastage in southern Australia is. You can see there the tan line, that's the branding rates for southern Australia. So if we assume a pregnancy rate of 90% of mated females, because this is the branding rate, is the percentage of calves branded of cows mated, then we're looking again at a and this is over quite a long period of time, a rolling average of about 8 or 9% calf wastage. And in New Zealand, they observe something similar, and they've actually said that it's despite some efforts, they haven't been able to improve that overall situation. But we'll address that in a moment. So what do we know about causes of calf wastage? Well, there's a very big study done in Western Canada, and so this covers most of the genotypes that are farmed in southern Australia. They involved about 30,000 cows. They did about 2,000 post-mortem examinations of aborted fetuses and stillborn calves and calves that died. And you can see there the breakdown of percent abortions, stillbirths, calf deaths. You can see that, you know, that calf deaths were the largest, and again that figure of calf wastage, 8.2%. Interesting, major causes of abortion were actually cow deaths. Not surprisingly, major causes of stillbirths were calving difficulties, death of calves in the first week as a consequence of calving difficulties, but also infectious diseases, pneumonia, septicemia, and of course accident and trauma. And then in older calves, we've got essentially severe mismothering and other non-infectious gastrointestinal problem. I put up here just out of interest because often there's some discussion about trying to induce twins. Well, in this study, certainly twins accounted for a significant proportion of abortions, stillbirths, and also death of live-born calves. If we look at the infectious disease, you can see there that, you're talking about of your abortions in this particular study, 1 in 5. It's probably a little bit higher in Australia, probably more like 2 in 5. And it's certainly contributing to, similar order of calf deaths. So that gives you a feel for the size of the problem. Let's look at how we might go about controlling this problem. And what we need to appreciate here is that there are many factors that contribute to an individual cause of calf wastage. All right. So this is a fairly busy slide. In the centre, I hope you can see my pointer. You'll see the key thing that we're interested in is what's affecting calf vigour, because we know that that has a big impact on survivability of newborn calves. And you can see there there's an array of environmental factors from very high ambient temperatures, so very hot conditions, through to very cold conditions, very muddy conditions. Yes, infectious diseases, congenital abnormalities. In the south, you don't see too much vitamin A deficiency. We certainly see it occasionally in Northern Australia. In the north coast of New South Wales, yes, you most certainly see paralysis tick. Occasionally you get Akabani virus infections. And we'll talk a little bit later about BVDV infection. We've talked about the impact of twins. And you can see here the linkages. So if you think about a calf be found dead, and a post-mortem examination, as they did in Canada, reveals that the cause of death is a septicemia, right? So when we start to think about, well, how are we going to prevent that from occurring? Do we look for, do we treat all calves when they're born with an antibiotic? Probably not. So we have to look at what contributed to that calf dying of septicemia. And of course, a key thing that would impact on the risk of this calf developing septicemia would be the quality and quantity of colostrum that calf consumes. And so we look on the left-hand side here at what affects milk intake. And you can see there that there is clearly impacts from the heifer and the cow, in particular the nutritional status, but also heifers experiencing dystocia are going to have a disturbance in milk letdown, and certainly the quantity of milk produced. Udder conformation plays a role. You may not see too many bottle teats down your way. We certainly see up in Northern Australia. the mothering ability is going to play a big role. So you can see there that to reduce the occurrence of, for example, calves dying of an infection that entered via the navel and caused septicemia. One of the key things is to focus on how we can increase the likelihood that all calves get sufficient colostrum, and that's going to require us controlling multiple factors that affect the quality and quantity of colostrum produced by the female, and then how much is actually drunk by that calf. And the vigor of the calf plays a big role. So when we're thinking about management strategies to reduce calf wastage, from that previous diagram that I showed you, I hope it is very clear that there is no silver bullet. That in the work we've done in Northern Australia, the producers that had low percentage calf wastage were producers that were well aware of the major factors contributing, increasing the risk of calf wastage, and put in place control measures to mitigate against those. And so when we look at the control measures, we divide it into four main areas. We look at managing the feed base. I put this one in here. This is actually out of Central Australia, but I do recall quite well visiting my old stamping ground in Tamworth during the drought, and there were plenty of paddocks that resemble this. Managing the feed base, critical. Managing lactation, equally critical. How do we get a cow to calve in good body condition? It starts right back at managing the time to wean that calf. We're going to talk a little more about managing cattle health and stress. One of the things we want to prevent is an outbreak of pestivirus infection, or BVDV, during early pregnancy, during that early mating period, or during mating, because this is what you can end up with. These are all persistently infected calves, and the majority of those will die in the first 2 years of life. The other key area is managing breeding, which includes managing genetics. So I'm going to only say a few words really about the specific diseases. Because the key thing here to appreciate is how is an outbreak of infectious disease, how does it occur in your herd? Well, most commonly it occurs when you introduce an infected animal or infected animals, or it could be an infected fetus. And this map, which over, I think it was over 4 or 5 years, they, using the NIS database, they mapped the movement of cattle around Australia. And you can see there are significant movements out of Northern Australia into Southern Australia, and movements out of Southern Australia into Northern Australia. 15% of your cattle movements were from sale yards to producers. What's the risk at sale yards? Well, at sale yards, cattle are often mixed, and transmissions can occur there, and then you bring home from the sale yard infectious disease. About a quarter of movements were from one producer to another. And when I'm talking about movements of animals, included in this would be within a farming operation. If you've got multiple properties, it would be movements between properties. It would be sending cattle away on adjustment, mating them while they're away, then bringing them back, buying in cattle. And as I've highlighted here in red, purchasing or ingesting mated females, bulls, are a particular risk. All right, a particular risk for the introduction of the major infectious diseases that affect reproductive performance, in particular calf wastage. And the ones that I've listed there are bovine viral diarrhea virus, you know it as BVDV or pestivirus, Vibrio, vibriosis, and trichomoniasis. These are your venereal infections. You might be aware of vibriosis as a cause of venereal disease. You might not be aware of trichomoniasis. In a recent piece of work where we cultured the prepuces of bulls slaughtered at a very large abattoir near Brisbane, we demonstrated very clearly that trichomoniasis is found across Northern Australia, from Western Australia, NT, throughout Queensland and into New South Wales. So this diagram here shows that, you know, we can carefully move infectious agents from one area to another. And the final disease there is Neospora. So how do you go about reducing the risk of an outbreak of infectious causes of calf wastage? Well, I've listed a few points here. The first is to actually know what the immune status of your herd is, and that obviously is what I vaccinate my cattle against. Is my vaccination protocol correct? Am I storing, handling the vaccine correctly? All right. Am I administering it at the right time? The next piece of information you need to know is, what have your cattle been exposed to before and are now immune to? Because you might find that if you're considering, for example, vaccination of your herd against BVDV, that in fact you've had an outbreak of BVDV in your herd, and the majority of your cows are currently immune. So they don't need to be vaccinated, but perhaps your heifer mob is not. There may be a high proportion of non-immune animals in that group, all right? That's fairly typical, and therefore that's the group that you might consider vaccinate, or you need to just ensure that you don't introduce new animals into that group, because you could carefully introduce a persistent infected animal into that group and cause an outbreak of BVDV. You should look at doing check testing of purchased or registered cattle before introducing them into your herd. And, you know, this check testing is best done on the property of origin rather than bringing them onto your place. Now, this may take a little negotiating with the other producers, but it makes good sense to know before you bring animals onto the property what is the risk that they might be infected with infectious diseases that are not present in your own herd. On arrival, you should, if you're purchasing in, particularly if you're purchasing in mated females, they should not be introduced into or put with other cattle, other females that have been mated, or other females that are pregnant. They should be quarantined and in a holding paddock with no contact with other cattle, and they should be allowed to carve out and to give you an opportunity to see, are there any problems here, and to be able to conduct an investigation and contain the problem if unfortunately you have introduced a problem. So the question always comes up to vaccinate or not vaccinate against these infectious causes of reproductive loss. And it really comes down to how risk averse am I, right? And I've dealt with clients and producers at both ends of the spectrum and everything in between. At the end of the day, it's very important to understand that vaccinating cattle is similar to purchasing an insurance policy. What you're insuring against is an outbreak of infection. That's what's going to have a big impact on your bottom line. So then the question becomes, which cattle should I vaccinate? And as I said before, you can that decision making can be informed by knowing what the immune status of your cattle are. And I should have emphasized when I was talking about that, the critical importance of understanding that if you test for it, let's say you operate a fair size herd of cattle and you've got them broken up into 9 paddocks of 100 females in each, all right? If you test the cattle in one paddock and you find most of those cattle have been exposed to VVDV, therefore the rest of the other 800 will be the same, that is a fatal mistake, right? Because on many occasions where we've actually tested every mob of breeding females on a property, we've found significant variation. So that's just something important to bear in mind. I've emphasised here with regards vaccination that the initial and the first booster vaccination or second vaccination, they are critical. That's what establishes a long-lasting immune response in these animals. That you really do have to get right if you're going to get protection. And with increasingly with the vaccines we have available today, there's some flexibility. In the past, the older vaccines, we were quite rigid in first and the second vaccinations being 4 weeks apart. Newer vaccines like the Pestigard vaccine, the interval can be from 1 to 6 months, which helps in the management of your herd. This question often comes up: what happens if I forget to give an annual booster vaccination? Well, if you've given those first 2 correctly, all right, and for example, you forgot to give, and you give the first annual, but the next annual you forgot, would it be a disaster? The answer is no, all right, because the protection, the immune protection that your cattle get from vaccination at 12 months doesn't suddenly cease. In fact, there's actually a very slow decline in immune protection, and so it's not an absolute disaster. I think, Hillary, I have probably occupied my time, and if I haven't, that just simply gives me more time to handle questions. I hope everyone's come with some very good questions, and thank you for your attention.
Thanks, Michael. That was a great presentation, really good overview. I'm sure there are some questions, so please get them in while we give Michael a little bit of a break. A few of you have got some in already. Just while I wait to get those questions in, just a reminder that these webinars are recorded and are available on the MLA website at a later date. So if you do have to run off, or if someone asks you, they're available on the MLA website. If you do have to take off now, you'll quit out the webinar and you'll be taken to a survey. Could you please take 2 or 3 minutes to fill out this survey? It just gives some feedback to presenters like Michael, the hosts at Home Sacket and MLA to make sure that the webinars are giving the right information that that you guys are after. All right, we'll get started on some questions now. The first one from Michael. Michael, can PTIC cows more than 3 months pregnant, PTIC heifers more than 3 months pregnant be infected with pestivirus? If so, what will the outcome be? And then a further question to that is, what about heifers that have not been joined yet?
Great question, Michael. So let's take the first question. We're talking about heifers that are pregnant 3 months. What happens if they come in contact with an animal persistently infected with BVDV virus? The answer is certainly there will be there could be rapid transmission. It's a highly contagious virus. An overnight yarding could result in 60% of naive females becoming infected. At 3 months, the developing fetus still does not have a functional immune system. Therefore, quite a few calves infected with fetuses infected with BVDV at 3 months will be born, if they survive, persistently infected with BVDV. So that's the first thing. You could end up with a range of problems which could manifest itself as you could see some abortions, you could see birth of calves that appear to be dummies because of damage to the brain. They could be born as weak calves, non-viable calves, right through to calves that appear pretty normal, but when you come to weaning time, you notice that there's quite an increased proportion of ill thrifty calves in the group, and this is your persistently infected calves, and many of those go on to die. Certainly, they're poor doers. So really, it's the fetus in cattle is susceptible to BVDV infection right up to about the 6th month of gestation. So that's important. Now, if you go to these non-mated heifers, all right, the issue there is if you are going to mate these heifers or run an artificial insemination program, then I can assure you that if unfortunately a persistently infected animal is put in with them around the time you're mating them, then the conception rates will be much lower, typically about half what you would expect, and unfortunately you might set up a second wave of infection, because when some of the initially infected heifers come back on heat, the normal behaviour of heifers and cows sniffing the vulva of each other can lead to a further wave of transmission. I hope that's answered your question.
Great, thanks, Michael, and thank you for the question, Michael. The next one from Mercia. Are you able to expand on BCS in cows and the effect of that on calf wastage, please?
Great question. So, having worked in Northern Australia for the last, or since 1988, we certainly encounter the situation of very poor cows trying to calve, and the problem there is very clear. It is low milk production, low quality colostrum, and often they are calving end of the dry season into the early wet season, and they for a significant proportion of the time the fetus has not been receiving sufficient protein, so that fetus is born less vigorous, and so chances of survival is poorer. So you have at one extreme, you have these cows calving in poor body condition, and the effects as I described. At the other end, and I've certainly done a large number of calvings in central west New South Wales, northwest New South Wales, where the situation is the opposite, where heifers in particular have been allowed to become over-conditioned, and the problem there is increased risk of calving difficulties. And it's very important to understand that a calf that takes longer to be born, the risk there is brain damage, the simple lack of oxygen to the brain, and those calves take longer to get to their feet so that they get less of that critical colostrum. The amount of milk they consume is less. So if it's very cold conditions, their ability to, or the risk of hypothermia is greater. The risk of infectious disease, particularly bacteria entering the navel and causing a septicemia, is greater. What you want is, you want your cows calving in good condition. Heifers in particular need to be obstetrically fit. All right? And so you need to think about how you can achieve that. But there's no question that obstetrical fitness, particularly in heifers, reduces the risk of dystocia.
Thanks, Matt. Oh, sorry, keep going.
Yeah, I was just going to further comment that talking about body condition score, you can quite obviously, if we manage the body condition score such they calve in good condition, and that, as I said before, starts back with ensuring that we wean our calves before cows lose significant body condition, then that not only has an impact on calf wastage, but also clearly has an impact on the likelihood of cows reconceiving. So it has an effect across the board as far as improving overall reproductive performance.
Could you also just comment, Michael, there's some questions that have come through here, and with the season that we are experiencing down south, in that it's a very good season and that everyone is, or most people are understocked. There is a question coming in about people being concerned about having overweight pregnant heifers. And could you just comment on the impacts of trying to reduce their weight at certain times of their pregnancy, and what people should be looking out for, and what impact that could have on lactation and the calf and calf survival?
Yeah, look, great question. First thing to be very aware of is you don't want to be making major changes in the nutrition of these heifers, in that in that last few months prior to calving. You don't want to be changing paddocks. You want them settled. So if you're going to be doing anything, it needs to be done now. And the approach that you can take, all right, you shouldn't take the approach that, okay, they're in body condition score 4 using a 1 to 5 scale. I need them in body condition score 3. So you know that's a full 60 some kilos that they need to lose. Now that level of weight loss could actually predispose to a number of other problems. So you're better off just reducing it gradually such that they reduce down to a body condition score of, say, 3.5. So they lose about 30 odd kilos. And how are you going to do that? Well, you're going to put them into a paddock where, you know, there is sufficient energy and protein, and you need to get advice on, you know, if you're not able to judge this just by looking at your pastures. But the drier standing feed, so would be better for these with just a small amount of green coming through. The other key thing is to just put them into paddocks where they're going to have to walk a bit. The biggest problem I find is where I see a disaster that still sits in my mind is where the pregnant heifers were in a paddock of lucerne and they were all camped around the dam bank, and the lucerne grew right up to the water's edge. So essentially they walked from the top of the dam bank down to get a drink and back, and that was the sum total of walking for the day. And they grazed around the bank. That's a disaster. So you need them to be walking. So where the area of grazing and the water trough are some distance away, that would be great. I've often said if you're supplementary feeding, you'll water them at the bottom and feed them at the top of the hill. That actually works. All right. So the key thing there is you don't want to induce a marked loss of weight. You want to just take some condition off them and at the same time increase their obstetrical fitness by getting those cattle actually walking.
Great. Thank you for that, Michael. The next one from Desiree, what are the suggested quarantine periods and what are the influences and variations between diseases? It's quite a broad question, but yeah.
Yeah, look, that's why I put down that if you're buying in mated females, in other words, females that have been exposed to a bull, whether they've been preg tested in calf, if there's any risk that they have been exposed to a bull, then you really you don't want them to be put out with the rest of your herd until they've calved down and you've had a bit of a good look at whether they've been you've seen cases of abortions or you've seen weak abnormal calves born and so forth. So my quarantine period is actually quite a long period. Now, if you're buying in females that have not been mated, well, the first thing I always tell people to do is just check that there are not some there pregnant, because immaculate conceptions occur both in southern Australia and northern Australia. Bulls and females get where they shouldn't all the time. So you need to first check that. I've got some pregnant animals in here where I don't want those pregnant animals then going back into my herd. The others, that's why doing testing to know what is the testing of incoming cattle is so important, because you really want to know, is there a risk that, you know, they could introduce Neospora to my place? Is there a risk that they've been exposed to a bull with Vibrio? Is there a risk that there's been exposed to a persistent infected BVDV carrier? And you can get that by just, if you've got, you know, you buy 50 females, bleed every 5th one, and that'll give you a good cross section, and that can tell you what is the risk. And this is where you're going to involve your cattle veterinarian to help you with the interpretation. What's the risk that these cattle could introduce any of these infectious diseases? Of course, if you're buying cattle obviously you can check on the vaccination status. Have they been vaccinated previously? You've got to remember, though, that all vaccines are not 100% protective, and we did the original work on the Pestigard vaccine. It's a very good vaccine, but there is a small percentage of females in a situation where where they're in close contact with a carrier animal, where transmission can occur to the fetus, and even though they've been vaccinated, they could produce a persistent infected calf. Now, the risk you can manage if, for example, you know, you've already got in place a vaccination program in your herd against the particular diseases that you're concerned about. So it very much depends on what you're doing, and I just emphasise the importance of checking cattle that you've sent away on agistment. There was a lot of cattle with this drought that were sent away and moved all over the place, and unfortunately they will bring back an array of infectious diseases to home properties, and people need to be aware of the risks of that.
Thanks, Michael. I think you mostly answered the next question, but one part of it that I think you didn't was, how expensive is it to test for pestivirus and other infectious diseases?
Yeah, look, this is a question that you really should take up with your local cattle vet, because if I give you a figure, it could be incorrect, in that I tend to deal with one diagnostic lab, and there is a little bit of difference across there. But look, if you were to say, I'm going to test 10 animals, and I'm going to test them for BVDV, Neospora, the Vibrio. So there's 3. I could even test for lepto. I'll make a comment about lepto in a moment. But let's say there's 3 there. About, I would have said, $10 to $15 per infectious disease. So that's 10 by 45, so that's $450. And the cost of getting the samples collected and so forth. What you've got to look at there is, you know, what is the risk that I'm going to introduce an infectious disease into my herd and cause an outbreak? And you can only judge whether that's a good investment by, as I said before, knowing what the immune status of your own herd is, and being aware of the prevalence of these diseases. Now, I can tell you that these infectious diseases are common in the Australian cattle population. The one that's interesting that often has been blamed for calf wastage is leptospirosis. And what we can tell you now is that in our experience in Northern Australia, and we've got loads of wild pigs up in Northern Australia, is that lepto is not a common cause of calf wastage in Northern Australia. From time to time, we most certainly do see outbreaks of the pig associated Leptospira pomona, and it does cause increased calf wastage, but it's not common. We very uncommonly see outbreaks of Leptospira harjo, which is the cattle-adapted Leptospira. But why do you vaccinate for leptospirosis? Well, you vaccinate primarily because it presents a major OH&S risk to people working with it, and you go down with lepto, it's a very unpleasant disease.
Thank you. Thanks for the question. The next one from Kurt. What is your advice for minimum vax schedule for maiden heifers before joining? Kurt's in southeast Queensland.
Well, the best way to look at heifers is this. The heifer is the future of your herd. When you mate heifers, here is your opportunity to apply selection pressure for fertility. So you want to use a short mating period, and you want to select only those heifers that become pregnant in the first 6 to 9 weeks of your mating period. So you don't want anything to go wrong. You want to give them all the best opportunity to conceive. So you need to mate them to fertile bulls. So bulls need to undergo breeding soundness examinations. If you look at the vaccination side, the question there becomes, well, let's look at the venereal infection, Vibrio, first. There's no vaccine for trichomoniasis. That's important for everyone to know. There is no vaccine. You can test for it. Collection of preputial samples from bulls. You can check for trich that way. But as far as vaccinating for Vibrio, the question then becomes one of what's the risk of stranger bulls getting in with your heifers? And you need to consider that that occurring prior to when you want to mate them, because a number of times we find that bulls have got in with groups of heifers well before the farmer wants to mate them, and have busily transmitted Vibrio amongst the females, and then they get a lower than expected pregnancy rate when they put the bull in, and that, unfortunately, that part of that is an overhang from the Vibrio. So you need to assess the issue of stranger bulls getting in with your heifers. If there is a risk, then I would consider vaccinating heifers against Vibrio. And if they're over 18 months when you vaccinate them first, then they only need 1 5 ml dose. If they're under 18 months, they get 2, 4 weeks apart. But if they're over 18 months, they only need 1. with BVDV, it depends very much on what I know about the herd itself. Is there a risk that there's a persistent infected animal that's going to be introduced into the heifer mob? If they're being kept as a group of heifers, selected heifers from weaning, if there was a PI amongst them, then there should be sufficient time for transmission to occur widely through the group. So they all should be immune. The problem comes when people do, and this occurs more often than you think, where people have a group of heifers put together, and then all of a sudden they'll find a couple of others from another mob, or they'll buy a couple, and they just drop them in with the mob. And unfortunately, they drop a PI in them. So again, this comes back to knowing, you know, what's the immune status in your heifers. If there is a risk that cattle are going to be exposed to neighbours' cattle and mixed and so forth, then this is where I certainly do consider vaccinating against pestivirus. The advantage with pestivirus or Pestigard vaccination is, you know, you can start the process 7 months before you're going to mate them, so that you can fit that in amongst your management program, so that, you know, they get one shot, and then about a month before you're going to mate them, they get their second shot. They're good questions, but it's very much, it would be one of those discussions that you really have to sit down with your cattle veterinarian and walk through what you're doing specifically with in your property and what's going on in the surrounding properties that affects the risk of an outbreak of infection in your herd, and whether you should be vaccinating. But I hope that gives you a feel for the type of vaccination strategy I would use.
Thanks, Michael. And yeah, definitely follow that up with your local animal health advisor. The next two questions tie in together, so I'll give them to you as one. Michael, the first one from Julian. I have some pregnant heifers to calve down in August. We've tested them for pesty and yonis, but can't determine if they ever received a 71. Can we safely vaccinate now? And then the following question from Edith. For 71 vaccine for cattle, what is the minimum time interval between the first and second vaccine that will still achieve adequate immunity?
Hey, they're good questions. Let's go to the first one. Can you safely vaccinate pregnant females with the 71 vaccine? The answer is yes, you can. All right. In fact, in situations where we've seen pulpy kidney in young calves, that's one of the ways to control it, is to vaccinate the cows prior to calving, and that gives a nice boost to the colostrum, so the protectiveness of the colostrum. So yes, 7-in-1 vaccination can be utilised. It's a killed vaccine, so there's and it is safe to use in pregnant females. Now, remind me, Hilary, the second question.
What is the minimum time interval between the first and second vaccine?
Yeah. The minimum time interval would be 2 weeks. Now, you got to. I preface this by saying you do have to read the instructions, and just for the particular vaccine that you're using, all right, to ensure that their label says, well, you should follow the label instructions. Oh, that was a bit of a roundabout way of getting to the point, wasn't it, Michael? Should follow the label instructions always. In our experience, 2 weeks is the minimum. So for quite some time it was 4 to 6 weeks between first and second. It can get as short as 2. Its ideal is 4 to 6.
Thank you for the question, guys. So the next one, there's a 3-part question here. I'll go through them one at a time so we don't get confused. From Richie, as a cow gets older, do you believe they have a weaker immune system, less likely to resist new introduced diseases?
No. Quite well. If you look at your herd, the group of animals that are typically most at risk of an outbreak of infectious disease is your young animals. So that's why in Northern Australia, I often recommend vaccination of heifers only. We know in these big herds that these BVDV, Vibrio, lepto are circulating in the cow herd, but the heifers, because they're younger, they just haven't bumped into these infectious agents, and they may, some may be immune, some may not be. So typically it is your young animals that are most at risk of an outbreak, because they simply haven't had as many opportunities to bump into these infectious agents as the older cows. Now, it depends what you mean by an older cow. I mean, we would say, and I think in Southern Australia you would say about 8 years of age, 8, 9 years. Up here would be about 10. There's no evidence that there is a decline in immune function in cattle of that age, provided they are in good condition. Obviously, cattle that are in poor body condition, they have reduced immune function, but that, and yes, in very old cattle where they're losing their teeth, or the teeth are very worn, yes, they're likely to be in poorer condition. Their general immune function is reduced, but that there is the effects of nutritional status, and in Southern Australia you're very fortunate in having very few areas of phosphorus deficiency, whereas in Northern Australia we have plenty of phosphorus deficiency. So that adds a further challenge to our older cows. Hope that answers your question.
Thank you. There's more from Richie. This one's a little bit left of field, but we'll see how we go. We have a herd of 71 females. For me, who focuses a lot on percentages, one breeder to calf is more exaggerated as a percent. Is there an easier mathematical equation for producers with less than 100 breeders to follow?
No, the calculation, I've worked with cattle producers who've owned one cow through to those that have owned a couple of 100,000. At the end of the day, the most important calculation you need to make is what is your live weight production from, and you can determine this per cow, per hectare, per breeding mob. So that's the most important. You've got to be and so that in a smaller herd, yes, I agree. Percentages, and well, if you take 100, all right, and 5 animals, 100, and 20 animals are affected. Now that's a 20% decline. So it looks like a big effect, and it might be a big effect, but really at the end of the day, you're in the business of producing beef, and so what you really need to look at is kilograms of beef produced from your herd, and that should be pretty straightforward for you to calculate. And in the easiest one that we use is weaner production, which is average weaning weight times the average weaning weight times the number of calves weaned divided by the number of cows that you, in your case, in the number of cows you mated.
And then a third one from Richie: will they bring back an Acabane vaccine? Sorry if I mispronounced that. And what's the current state of Acabane in northern New South Wales this year?
Very good question. The answer, tragically, is no. I work very closely with one of the virologists that did a lot of the original work on the effects of Acabane virus infection. And when I spoke to him recently, both of us were lamenting the fact that a very efficacious vaccine was no longer available. Unfortunately, it's no longer available because producers were not purchasing it, and so it became a simple business decision for the manufacturers. So how do you manage that? Well, it comes down to understanding at what times of the year transmission is occurring, and so if you look at northern New South Wales, transmission's typically occurring through that spring-summer period, and so what you need to avoid is having, if you can, and you can do this by altering your mating time, becomes more relevant when you're talking about what time should I run an embryo transfer program. But adjusting it such that you're not going to have females anywhere between about the third through to about the 6th or 7th month pregnant during that time, because that's when you're going to get there's a risk of transmission. That's when the biting midges are active, and they're the ones that transmit the Acabane virus infection.
Great. Thanks for those lot of questions, Richie. The next one from Sally. Michael, did you get any information on the incidence of, excuse me if I mispronounce this, trichomoniasis in the testing that you did?
Yes, we did, and we'll be publishing it. So I probably should, this is unpublished information, but what I would say to you is, look, it's about as common as Vibrio. So and that's why we did the work. I was interested. I was receiving reports from New South Wales of outbreaks of trichomoniasis, and this was a disease that many people thought was really only occurred in North Queensland, the Northern Territory, Kimberleys, and so forth. and the reality is it is occurring in the southern beef production area. And as I say, with cattle moving around, it is a problem. Where is it? What would be a risky thing? Buying an older bull would be, so in the absence of a vaccine, you minimise the risk of a bull becoming persistently infected with trichomoniasis in the sheath and penis by maintaining a young bull herd. So young bulls are more resistant to becoming infected compared to mature bulls. And in our study, I can tell you that I think all but one of the bulls that we isolated from were full mouth.
Okay, we'll look out for that one coming out. The next one from Jane. Do any vaccines interfere with the functioning of any other vaccine?
It's a very good question. I'll put it to you this way: in an ideal world, you would avoid administering more than 2 vaccines to an animal at a single point in time. What I would say is there is a significant immune response, and in cattle, because it is challenging, or it's difficult to stimulate their immune response. Then in the vaccine there are they're chemicals that stimulate the immune response, and so there's a generalized stimulation of the immune response in animals when we initially vaccinate them. And that's generalized stimulation, probably lasts for something like a week, maybe 2 weeks. The golden rule is, it's perfectly okay. And if you look at it, the situation in the US, they have vaccines there with, we have a 7-in-1 here. They'll have 9 infectious agents, and the evidence is that they're generally getting satisfactory immune responses. What I was going to say before, the golden rule is you shouldn't vaccinate using a live vaccine and a kill vaccine at the same time. So if, for example, if you are in the where there are cattle tick and you're vaccinating your young stock to prevent redwater, babesiosis and anaplasmosis, then that should be done as a single vaccine, and no other vaccine should be given at the time, because although the vaccine has been improved considerably, there is some, they develop a low-grade infection. That's how the immunity is developed. But if they're killed vaccines, all right, then it's quite safe to administer several vaccines at the one time. I think the other important thing is to think about where you're giving these vaccines. I have seen some pretty awful places people have thought to vaccinate. One of the worst is vaccinating bulls for Vibrio in the tail, in the anal fold. Causes very big lumps, quite painful. The best place is directly behind the hump, or where you would imagine the hump in Bos Taurus.
Thank you. Thanks, Michael. We're getting through the questions now. The next one from Janet. What are dummy CVS and what abnormalities are common with BVDV?
Sorry, I didn't catch Hillary the first. What?
It says, what are dummy CVS?
Dummy CVS.
Oh, dummy calves. Sorry. What are dummy calves?
Dummy calves. Yeah. Okay. What are dummy calves? Good question. I'll deal with that one first. Dummy calves. We see this with Akabani virus infection. We see it with BVDV infection, typically with BVDV, both with BVDV and Akabani. If infection occurs around that 4th, 5th month when the brain is developing, then it can induce quite a severe malformation where effectively the brain that controls all coordination doesn't develop, or the thinking part of the brain, the cerebral hemispheres, they don't develop at all. So it's particularly those latter ones that present as dummies, and they're blind, they don't actually know where, and they just bump about, and invariably, unless you're prepared to bottle feed them, they have to be euthanized. Now, it's important to understand there are other non-infectious causes of dummy calves, and that's why, if you get a couple of these, you should be talking to your cattle vet and getting a post-mortem examination done, because it could be there are semi-lethal, lethal genetic diseases that can produce dummy calves. So that was that question on dummy calves. What was the next question, Hillary?
The next one was, what abnormalities are common with BVDV?
Very good question. The abnormalities that you see are entirely dependent on when during the reproductive cycle a female that has no immunity to BVDV, that is, it's not vaccinated and it's never come in contact with BVDV, therefore it's what we call a naive animal or a non-immune animal. The signs we see depend very much on which stage in the reproductive cycle. So I'll summarize it this way. If they're exposed just prior to mating through to the 2nd week, then what you see is failure of conception. And so you have, all you'd have is an increased proportion or more than expected number of females coming back on heat that you had mated or seen the bull mate. If they're infected during that between that 2 weeks through to about 3 months, then we can get abortions. We can get females that appear to have been pregnant but then suddenly come back on heat. That's how it might present. Occasionally you might see an aborted fetus. Most typically the clinical sign is they're either turn up non-pregnant, or instead of being well pregnant, they're only just pregnant if you've used a long mating period. If they're infected in that first between the 1st month and the 3rd into the 4th month of gestation, then that can result in the birth of calves that are persistently infected with BVDV. They can present anywhere from being weak, poor-doing calves through to perfectly normal calves, some of which have won grand champion at Sydney show and the Ekka. This is a fact. But invariably, these persistent infected cattle die. Vast majority of them die in the first 2 years of life. And they die of this condition called mucosal disease, where they start to develop ulcerations on the tongue and in the mouth. You can have birth of calves with damaged brains, as I said before, and these present as incoordinated calves. And it depends how closely you're monitoring them. They simply could just turn up as dead calves because they didn't have the coordination required to get a drink of milk after being born. So quite an array of signs. I think for many producers, they may or may not have known that an outbreak of infection has occurred until, as I said before, calving starts and they've got an increased proportion dead calves, poor doing calves, or comes right round to weaning time and they've got quite a marked tail in the weaners. They're ill thrifty, scouring a bit, and it turns out that these are persistent infected calves. So it can be fairly insidious, and that's the problem with it.
Just to follow on from that then, Michael, so when is the best time to vaccinate for BVDV? And then Penelope's also asked, is there any truth in the theory that the lepto vaccine only lasts 6 months?
Right. Okay. When is the best time to vaccinate against BVDV? Well, you need to know when you're going to commence your mating, and depends. So let's look at heifers. All right. Typically, we want them to receive their second vaccination about 4 weeks prior to joining, right? So that means they go into the joining period fully protected. And that's the crucial time, is that first, as I said before, the first 4 or 5 months of pregnancy. So if we time our second vaccination remember I said we start off with a priming vaccination, and then the second booster vaccination, we want that to occur a month before we're going to mate them. When the timing of the first vaccination is quite flexible. It can be anywhere from a month to up to 6 months between the first and the second. So that gives you quite a bit of flexibility. The key thing is to ensure that second vaccination occurs, as I say, just prior to mating. So we talk about 2 to 6 weeks prior to mating, and then thereafter depends on what program you're going to do. In some of my herds, the heifers receive 2 vaccinations, and then I know that there are carrier animals in the cow herd. Most of the cow herd are immune, and the heifers enter the cow herd having been vaccinated before and protected as heifers, and as their immunity wanes from the second vaccination, I rely on the bumping into the PI to boost their immunity for longer term immune function. Alternatively, particularly where you're managing a short joining period and you want to keep it that way, then you will following the second vaccination, you will give them an annual booster, and that annual booster for BVDV, again, I typically make it 4 weeks prior to joining. So vaccinated, they get their second heifer vaccination 4 weeks prior to joining. So as first lactation cows, they get the annual booster just prior to being mated. But it varies according to how people are handling their cattle. Some people will vaccinate, give them their booster when they preg test, because it just is the most convenient time. Is that okay? Yes. As I said before, they're following that second vaccination, you've got at least something in the order of 12, 16 months of full protection, and then it just the protection doesn't suddenly stop. It just slides down, so that if the interval between your second vaccination and the annual booster is, say, 14 months, no big problem.
Thank you.
Oh, question about the lepto.
Yeah, did you want to answer that, or we can leave it?
Look, to me, it goes to this whole issue of, correct storage of vaccines. I see one of the things that I quite routinely do if I'm doing, as part of a biosecurity check on a property, will be to check the fridge. That can be a fairly illuminating exercise. The bottom line is they have a use by date, very important. I think the question probably is, if I've opened the vaccine, how long can I keep it stored for? Most of these vaccine manufacturers have that on the label as to how long they can be stored opened, and that's what you've got to go to. You've got to be careful that I've seen situations where the vaccine has become contaminated with bacteria, and of course that can end up with a whole bunch of vaccination abscesses.
Great, thank you, Michael. Forgive me if you've already touched on this, but Andrew wants to know, what are your thoughts on giving maiden heifers a dose of, I think it's PI, blood/serum, before joining?
Right. Well, let me tell you the story. Up until 2003, in Australia, we did not have a vaccine against BVDV. We commenced doing work on the impact of BVDV. It was part of my original PhD research in 1985. And so in that period, from 85 through 2003, we looked at various ways by which we could induce immunity. One of which was collecting whole blood or serum from persistently infected animals and injecting animals with it. And yes, that would induce infection, and similar to or virtually the same as a natural infection. Why people are interested in this is that animals that are naturally infected are, for all intents and purposes, have lifelong immunity. Now, we've quite quickly moved from using blood or serum from or plasma from persistent infected animals to just using virus cultured in the laboratory, because there is a risk that if you take blood from an animal and you inject it into another animal, that you're transmitting other diseases. And in fact, this, you need to check in your state as to whether that is against the law to do what is being described. It has received some negative press. The other thing to bear in mind is that if you're going to do something like that, the very strict criteria that we applied was that the animals that we vaccinated with a live vaccine, either virus culture or blood from a PI animal, we always checked and pre-tested them first to make sure that none of them were pregnant before we vaccinated them. Because if any of them are early pregnant and you use one of these live vaccines, then you will, in a high proportion of cases, induce the birth of further persistent infected calves, which is not desirable at all.
No. All right, interesting topic. The next one from Desiree. I note that there is considerable research on a vaccine for neosporosis, but so far only live attenuated vaccine in Spain. Is there any work being done in Australia to develop a vaccine given the widespread issue with dingoes and wild dogs in Australia?
Very good question. The answer is no, not to my knowledge. There has been work done. There was Jenny Weston in New Zealand did quite a lot of work investigating the efficacy of a Neospora vaccine. To date, none of the vaccines that have been developed have been shown to be very efficacious. Our conclusion from the extensive work we've done across Northern Australia, where we monitored the performance of some 78,000 breeding females over a 3 to 4 year period, and we did cross-sectional sampling of every breeding mob that we monitored, and there was about 142 breeding mobs in this. We were not able to demonstrate a significant association between Neospora infection and calf wastage. There was a bit of a trend for slightly higher, but it certainly wasn't significant. BBDV, we demonstrated a significant impact. Vibrio, a significant impact, but not Neospora. That I am not saying that Neospora cannot cause abortions in beef cattle and dairy cattle. It certainly does. And particularly in dairy cattle, we've experienced in northern and southern Australia outbreaks of abortions. But as I say, for us in Northern Australia, where wild dogs are very common, our approach at this stage is living with Neospora. Now, there's various ways that you can approach this. You can, I think Neospora potentially is more of a problem, could be more of a problem in Southern Australia, simply because you mate heifers as yearlings typically, whereas in Northern Australia we mate them typically as 2-year-olds or rising 2-year-olds. And I think because of that difference in age, more of the heifers in Northern Australia, and because of the prevalence of wild dogs, have been exposed to Neospora before they're mated, so they actually go into the mating period immune. So is it potentially a problem in Southern Australia? Yes, and I would suspect that where you could have, if we could get a vaccine, the group that you would target would be the Heifers in particular, simply because they hadn't been exposed. But no, unfortunately, there's not a vaccine, and worldwide, there's no, I haven't seen any evidence that there is an efficacious vaccine about to be released.
Thanks for the question, Desiree. The final question for this evening from Janet. What is the youngest age to vaccinate calves still on mum?
Oh, good, yes. Probably the youngest age I would have said is around 6 weeks. 6 weeks of age.
All right. Sorry, can you
There's
expand?
there's some, you know, like you could. I've just before I came on here, I thought, oh, someone might ask me that question, so I had a look through what was, you know, what the makers of the vaccine were stating, and they were typically, you know, talking about, you know, in that around the 2 month of age. It does depend a little bit on, you know, the how well grown that calf is. You know, if they've had a good start, typically good start in life, then at 2 months of age, their immune system should be ticking along and should be able to respond to vaccination. If they've had a poor start, so, you know, for a variety of reasons, then I wouldn't, you know, I would delay vaccinating those calves until, you know, probably more like about 3 months of age. So it's, you do have to just have a little bit of, look at the calves and see how well they've grown since birth.
Great, thank you. Thanks for that question, Janet. All right, that's all for this evening, everyone. A really hefty question time there. So thank you very much, Michael, for answering all those questions and for your presentation. There was a lot to take away from that. So yeah, thank you for your time this evening, and we'll see all the attendees at the next webinar.
Thank you very much, Hilary, and thank you very much, all the producers. And I wish you all a very, very good upcoming winter, spring season. For those of you planting crops, I hope you get a good crop this year. And for all the producers, let us hope things settle down a little with our Chinese colleagues.
Yes, hear, hear. Thank you, Michael.